and it immediately zooms in on us. Interesting. So should I change it at all?
It's recording.
I know it's recording, but I have to edit. I'm gonna have to figure out editing later. Okay.
Uh-huh.
So now I feel like the intro just comes naturally. I'm Ginger. This is my daughter, Rooty-Tooty, and I'm gonna pause. All right, so we're going to talk today about EDS.
Mm-hmm.
EDS stands for Ehlers-Danlos syndrome. Ehlers. When you say it just one word at a time, it doesn't flow off the tongue very well.
Mm-hmm.
Ehlers-Danlos. They're two last names of two different scientists who discovered the disease. Different years, different countries, but kind of close together when you look at the big scheme of medical science. Anyhow, there are many types. I want to say there's possibly, I think we're up to 16 and growing, or counting, depending on how you look at it. I don't think EDS types are growing. They already existed.
Uh-huh.
We're just counting them.
Yeah.
So, let's see here. Rooty-Tooty, when did you think, and you're 12 years old, we'll say that, I might edit it later and say, you're younger than working age. Fix your hair, pretty girl. So, anyhow, before you got a diagnosis, did you ever think, man, I am not like other people?
Yeah.
What made you think that?
Little things like being able to bend either whether it's my fingers or you said that I walk differently, and stuff like that. It made me think basically, yeah, I'm not like other people.
Okay. Did you really notice that your hands or fingers bent differently before your diagnosis, or did you really notice when the geneticist asked you, "Can you do this?" Before. And this, what would happen? What did you notice?
That and I could bend them backwards.
Yeah.
And
did you just do it for yourself? Did it happen on accident? Did you do it for other people?
And most of the time, I would just be trying to stretch, and I normally I wouldn't really notice much, but and sometimes I notice that they go back a lot.
Mm-hmm.
And whenever I would do it in front of other people, sometimes they would notice, that's not normal.
Okay. All right. So you noticed that your fingers being hypermobile, and people saying, like me, maybe grandma, saying that your feet, your legs look different, or how you walk is different.
Yeah.
And having you walk for the doctor, I think the podiatrist.
It felt normal, but
yeah.
After a little while I noticed that, it looks different.
Yeah, and it's hard to look at your own feet when you're walking. All right, so for our audience, what she's talking about, what felt normal but looked different, oh my gosh. When she was younger, it looked like she was practically walking on, if this is my foot, right? And this is my leg, which if you're walking would be like this, but that's awkward for me to keep my hand like that. And if this was the ankle, it almost was like she was walking on her ankle. Like walking on this part of her foot. And I've watched out, I guess I've been more likely to look at my kids, how they walk, their feet, their legs, just because I have had my own foot problems that were genetic. I have foot problems I have foot problems that other women have, but I had them as a child, and I have bunions, and most women get those from wearing high heel shoes. Maybe people and like tight. A lot of women are like, "Oh, my feet are smaller than that," and they'll cram their foot into a little tiny shoe, and they'll walk around like this, and then this knuckle on their big toe gets big and pushes your bones around, and the whole thing gets messed up. Well, I think I noticed a difference though. Most of those women, their foot looks normal. They just happen to have a bump on it. I was not that fortunate because mine was because of how I walked. I learned later because of my tendons and my ligaments affecting how I walked. It changed the whole foot, and I can talk about that later. So, knowing that about myself before knowing anything, I had never heard of EDS. I was wondering, are my kids going to have this too? Because I have a brother. That was the other thing, is like, you go to the podiatrist as a woman. I went in my 20s, my early to mid 20s, and, they're going to assume you're wearing high heel shoes and that's why you have bunions. But when you say, oh, I know that I've had bunions at least since I was 7 years old, and my brother has a bunion on his left foot, then it makes him think, oh, that's another reason why you have bunions. So that's why I was looking out for bunions or any foot deformities of my children. Let's see here. So when in early development as a baby, everyone's legs are turned in, their feet are turned in. Why? Because you were in a womb, and there's not a lot of womb in the womb. There's not a lot of room in there. And so your bones and your cartilage, everything's a lot softer so that you can stay folded up nice and snug inside the womb. And then you're born, and nothing changes much till you start walking and developing that muscle tone from pushing against the ground or whatever with your feet, or and your feet start off like this, and then they gradually turn out. And I learned that your straightening out takes until you're like 7 to 9 years old, about 8 years old. So when did I think I first had her legs examined.
And I was 10 and they still hadn't finished.
Well, yeah, but I already knew that they weren't going to straighten out by that time. And I'm trying to think, somewhere between the age of 3 and 7. But I can't remember exactly when, and I'll have to get back to you on that. There was I could have, her primary care physician said that they could either recommend that she goes to see a podiatrist or an orthopedic surgeon. And apparently, podiatrists and orthopedic surgeons have very different views on what to do about inturned legs. And I kind of wish that I had taken her to a podiatrist instead and maybe had her get orthotics. But the thing is, not just orthotics, but rigid inserts. But when your kid is still growing, you'd have to buy these things all the time. They're not covered by insurance, unfortunately. Insurance doesn't cover orthotics or inserts unless you have diabetes, even though your foot problem can be completely unrelated to diabetes. And let's say you get surgery for a foot problem, and it's even surgery that insurance will cover. It's kind of like braces for your teeth. You can get braces put on your teeth to straighten them, but they don't stay straight without retainers. If you have surgery, it corrects the foot, but it doesn't correct what caused the problem in the first place. So you need orthotics to keep the change in place. And insurance says, good luck with that, I guess. Yeah. Let's see here. So, I remember. So at the time when I took her to see an orthopedic surgeon, they said that braces weren't going to help. There's no risk. The only surgery you could do would be cosmetic, and it would have to break her femur bone right below the hip to straighten out her legs. And I don't think she even mentioned, and that was just the because her femurs turned in, and then the tibia, fibia are turned in, and I'm like, did I say it? Because I always wanted, is it like fibula? But no, that's not. Tibia, fibia, and then the feet. Each, it's torsion. All right, that doesn't really do anything. Okay, so you break the bone, and then you turn it. Now what? That doesn't necessarily mean that all the muscles and tendons, all the connective tissue, are going to work in a way that keeps in. Because I don't think that doctor knew why her legs were turned in. I thought it was interesting that she told me, they were turned in, and they're not going to. That like it'll probably improve some, but that she won't have straight legs by the time she's 8 years. Like once she reaches 8 years old, that's as straight as they're gonna get on their own. And so then you wonder, that's it? I don't do anything, Let's see here.
And like most of the time it's fine, it just feels normal to me. But even though it feels normal, that's mainly when I'm barefoot. Finding shoes is difficult. And like already the way my feet are, even if they didn't, even if and they weren't interned and stuff like that, it's already difficult, and now it's because of my size and shape.
What she's saying is she has wide feet that are with short toes, as opposed to it's a lot easier, I think, to find shoes for a narrow, long foot. But Flintstone's feet or duck feet shape, it's hard.
Yeah.
Especially, it's easy to get kids slip-on shoes, but she has a hard time getting her feet to slip in slip-on shoes, because when you open up a slip-on shoe, it makes the hole more narrow, which doesn't help when you have a wide foot. And then I think what makes it more difficult to find a shoe for her is because her foot doesn't move properly, that causes other problems like calluses and little, but like she doesn't have a big bunion on her big toe knuckle, but I know from seeing an x-ray that these foot bones are making a V shape, which will produce a bunion here, but she has a big pinky bunion, a tailor bunion here. And now that makes that takes even more shoe space. Also, she used to complain that her knee pit was sore, and I didn't know exactly why. I knew she had interned legs. I didn't know if the interning
happened when I would sit like this for a long time.
Right. Well, I thought that perhaps what would happen was when she'd be riding in the car, say as a toddler, because it probably bothered her maybe even as a baby. I don't know, but as a preschool age, about 3 years old, she was old enough to communicate in a way that she could tell me that the back of her knees, what we called the knee pit, would hurt, and I didn't know if it was just because of her like car seat, her booster seat. Was it under her knee pit in a way that was putting pressure there and hurting her? She can't tell me. She doesn't know. She just knows that it hurts. Was it because she had interned legs and then therefore was causing strain, or was it pinching a nerve? I don't know. I can't find these things out. And if you take x-rays, it doesn't show everything. It just shows your bones. You know, x-rays are not very good at showing problems with nerves and soft tissue. So I just kind of would have to wait and see, what else? I didn't know that this meant that there was a problem, but I did notice when she was very small taking a nap, and she fell asleep on the couch. And I was like, is she on her stomach or is she on her back? Because her head was turned like this, and I wanted to pick her up from the couch to her bed. And I was like, if I pick her up the wrong way, her head's gonna go too far the wrong way. And yeah, go ahead, show me how far. I mean, she can turn her head past her shoulder, and when you have like a 2-year-old or 3-year-old that's all relaxed, an 18-month-old that's relaxed and flat, like Jello, you don't want to wake them up, and so you don't. The more awake you are, the more rigid you get, right? So if I don't want her to wake up, she's still going to be like jelly, right? And I was like, if you're on your back, you pick them up like this, right? But if they're on their tummy, you pick them up a different way, or maybe you roll them over or something. I didn't want the poor girl's head to snap, okay? So I didn't really think much of it. It just was an observation of like, wow, her head's... Like, I would not know which way her body's facing, and then I had to check. And I don't remember which way it was. I just know your head was facing too far, the wrong direction. Let's see here. Now, I did eventually take her to the geneticist, and the geneticist asked me if you had been a floppy baby. I had to think of, like, what does that mean? Like, some kids, they have a temper tantrum and they flop themselves down. Or was she... And I was like, a lot of babies are very chubby, and most babies don't have a great deal of muscle tone, so I thought that pretty much all babies are floppy. That a non-floppy baby would be the exception, right? So, but I thought about it, I was like, I guess. I couldn't really definitively tell the geneticist, yes, I had a floppy baby.
Maybe comparing me to Monica?
Well, and that's what I did, was my other daughter, I was like, okay, if you held Annika at a certain age, and if she was facing out and I'm holding her like this, she had her arms up, looking around, and this one was like, but I just thought that was a personality trait. I didn't think that was floppy baby, which can be an indication of poor muscle tone. And I'm like, again, babies don't really have a lot of muscle tone, so. What else? Oh, so I took her to the geneticist not because I suspected EDS, because I had never heard of it. So I had a coworker who was talking to me about having NF1, which, if I remember correctly, stands for neurofibro something or other. We're not going to worry about it because she doesn't have it. But it was NF1 was the short version of saying it, which is, it's a, do I want to say genetic or hereditary? It's a hereditary condition. It has to do with your DNA, blah, blah, blah. And you get neuromas, which are little tumors on your nerves, which can cause pain. You can have interned legs, which she has. She has actually had a neuroma, but I know for sure, well, I'll get to that in a moment, but, okay, here. She had a lump under her tongue, which I presumed was a myocele, I think that's what it's called, which is like you get a gland, like a salivary gland under your tongue gets blocked, and you get a little lump there. And usually it goes away, or the blockage comes out, or you pop it or something, or you kind of can... whatever, right? It comes undone. And hers wasn't, and it was bothering her. And so I took her to a doctor, and it was actually a head and neck surgeon. And I thought they were going to pop it, but they snipped it and stitched it, and I thought that was the end of it. But then...
a while later...
yeah, she had another lump.
I got another one.
Yeah, but I could tell it wasn't a blocked gland. It was deeper into the tongue. She could kind of push it forward. It was white. It looked like a white bead was under the pink skin of the tongue. and it was getting bigger, and then she had to have surgery where she was under general anesthesia. She waited a while because I was like, look, it's gonna hurt, because the first time they just gave her like like the equivalent of Novocaine or something like that to make it numb, and they snipped it and stitched it, and it hurt for a couple days.
And I was scared because I remembered what it felt like, just to do simple things, and such as like I didn't need to move my tongue that much for it to hurt a lot.
Oh, talking.
Yeah, talking,
swallowing food, trying to brush your teeth and spit and all that stuff. So it was like, was it going to be worth the pain, the long-term pain, or it's not really long-term, but like a few days of pain? At some point we have to do something, but do you want to wait? So that's what we did. We waited, and it's like, okay, we got to go back. And so I knew it wasn't a blocked duct anymore. In theory, it could have been from the first little surgery, could have nicked a nerve, and then the nerve develops like scar tissue on it, and that would be a neuroma. And that would have been what they removed the second time. Unless it was already a neuroma the first time. If she develops another one, it can't really prove there's no way to prove whether or not the first one was a neuroma or a blocked salivary gland, because the doctor didn't know what it was the first time anyway, which makes me wonder, was it a neuroma? It just wasn't as white and maybe not as hard, right? And I don't know how long it had really been, I don't know which one had been there longer, because we know the second one we can trace back to the surgery. But the first one, we don't really know when it started. Anyhow, but the neuroma, this little tongue problem started after her EDS diagnosis. If it had happened before, I would have been like, you can't tell me she doesn't have NF1. And so NF1, interned legs, neuroma, pain in random places. It can seem like random pain, but what's really happening is it's the nerves, right? Have these little lumps on them, which cause pain. Lots of birthmarks, which she has. Like most people have a birthmark. She had, there's a certain number of birthmarks that you have to have for it to be considered you have NF1. And when I took her to the geneticist, I thought they were going to count the birthmarks. And when she was little, her skin was much more fair, and the birthmarks were more, she has one specific birthmark on her tummy that not only is it big, and it's just like a cafe au lait spot, it's light, it's a beige color, and it's like a splat, but it has a distinct, like in the middle of the tummy where the belly button is, there's a straight line. And I always knew it meant something, and I remember her doctor saying that it meant something, and I don't remember if she knew what that was, or sometimes doctors will notice something that means there's another problem, but you probably haven't shown symptoms yet. Maybe the symptoms are there. Maybe you don't. But she was a baby, so she can't tell me, right? These things develop over time. I think a lot of things are always there, but you, first of all, don't know that it's not normal. Second, as an infant, as a baby, as a young child, you can't communicate what's really going on. So to the doctors, it might seem like something developed over time, but that's not necessarily the case. Not only does the child think that this is, I have this, I think it's normal, everyone must be like this, but as the parent, sometimes you don't know that what your child has isn't normal.
Yeah.
Or maybe you have it too, and you're like, yeah, that happened to me, get over it, no big deal, that's normal. And you as a parent don't know that that's not normal.
Yeah.
And That is true with many conditions, especially rare illnesses and things like that. Other signs. Let's see here. Oh, so NF1. Another symptom of NF1 can be having these little flecks in the eyes that look like freckles.
Mm-hmm.
They're called nodules, I think. And her father has green eyes with these brown flecks in them. And if you look at a picture of NF1 eye nodules, and if you look at a picture of like his, they look the same. It's really was hard to tell. And so, they ask you the question: does she have this? Does a family member have it?
Mm-hmm.
And I went ahead and said yes, only because I was like, I don't know that they're not. I want them to check out my daughter. I'm not going to drag my ex in here for an appointment to see if I'm not paying for that. I'm paying for her. I have insurance for her. I don't have insurance for him, okay? So I need you to look at my daughter. Tell me, are these nodules? Are they just, because I know I have freckles in my eye.
Mm-hmm.
They didn't necessarily look like the pictures in there, but I'm not the professional. You are. You tell me, are they these nodules? And I'm trying to think. And her eyes are very light. She has silver eyes, which can sometimes look light blue, sometimes light green, sometimes look gray. And when they look green, the light has to hit them a certain way. And when they're light green, you might notice these pale gold flecks in her eyes. Now, I have blue eyes, like a dark blue eye, which I have a amber sunburst and maybe a slightly darker freckle, which is a brown color. Her dad has light green eyes with medium or dark brown spots in them. And
I'm not sure if this is relevant to like the EDS thing, but didn't you say that they used to be blue?
Yeah, a lot of times green eyes start off blue. Like right now, yours are light blue anyway. Do you mean your dad's?
Yeah.
Oh, yeah, and his were blue and then they turned green, but that has nothing to do with EDS right now. So, what else? So I was like, I don't know, maybe she's developing these nodules. Again, I'm not the expert. All I know is I do see these flecks in her eye. One of these symptoms of NF1 is these colors in your eyes. I can't remember what else, but anyways, so I have this coworker who's describing things that she experiences, and she has NF1. I'm like, oh my gosh, because my daughter had all these different things. She had these birthmarks, inturned legs, pain. I think you might have been being examined at the time for attention deficit disorder. She had some social awkwardness, and she didn't. There's some kind of test. I can't remember what it was called right now. And she scored really well, so it didn't seem to indicate that she had these social issues, but you could see her have these social issues. And I think that because she does so well in language, both of my kids were very good early on with what's it called? I'm having a moment where I'm not doing so well at this. I'll get back to it. Anyways, they had great vocabulary and something else. So there's multiple, like say there's 5 parts of this test that I can't think of what it is. And one of them is language. Well, her language was so high. If her language hadn't been so high, she might have got the social awkward confirmation, but she didn't. So I'm thinking, man, this sounds a lot like my kid. I'm going to get her tested. So her pediatrician, I told the pediatrician, I didn't just go, hey, my kid has NF1. I took them first to the pediatrician. The pediatrician said, wow, there seems to be enough symptoms to indicate that she should go to a geneticist. And then the geneticist the geneticist didn't even count your birthmarks. I was really bummed out. They're like, how many does she have? I'm like, I mean, I've tried to count them, but as you get older and your skin gets a little more tan, it's harder to tell. Like, your birthmarks can start to blend with your skin, and hers has started to blend with her skin. So, they were like, no, there's not enough,
The only one I
birthmarks.
know that's there is
The one on your
Yeah.
tummy, yeah. So, so then the geneticist said she doesn't have NF1. And I was like, all right, not that I'm mad at that. I'm glad she doesn't have NF1, but something is going
Yeah.
on. What is it? Between the intern legs, the birthmarks, the pain, the attention deficit disorder, these things all seem like they're unrelated, but why does she have them all? I know there's a reason. I know they're connected. Whether it's chemistry, genetics, something's, I just wanted to know what it was. And so I said, well, what does she have? What about the pain? Because that's important. Because doctors can easily say, you have crooked legs. Get over it. You know what I mean? They can say, lots of people have attention deficit disorder without any reason. What else? People are socially awkward, but she scored high in language, so she's not. Okay, fine. But you have to care about pain. And I had no explanation for the pain. Unless you were going to tell me, I don't know, something that causes inflammation or something. So she said, she's hypermobile. Oh, she did some hypermobile tests on you. Oh, and she said she probably got it she asked if I was Jewish. And at first I was like, that's the craziest, why would you even ask me that? What does religion have to do with my medical condition? Like, unless there's some religious observation, like you abstain from pork, for example, and people who abstain from pork get rubbery bodies, you know what I mean? I have heard of people getting problems from being vegetarian, but not from being Jewish. I know, like, people of African descent get sickle cell anemia. People who are Asian get certain birthmarks. I'm going to pause here. Anyhow, so some other signs that whatever it was, something was definitely different about my child was, she used to, as a baby, she would have like this mucus come out of where your tears drain into your nose, which makes snot. Mucus was coming out of there, so something was blocked, and the regular doctor thought, oh well, her whatever that duct is called is just blocked. It usually opens, but maybe hers hasn't opened yet. And come back in like a month or something like that if it hasn't. And then I brought her.
I grow quickly.
Okay, well that is true. Yeah, it is kind of ironic that they were trying to attribute this to